Okay, so kind of go back to the original question. What we did find in our study looking at hyperphosphatemia and infigratinib is that when we took our phase 1b expansion cohort, which was 67 patients, divided the patients into two groups, which one group had hyperphosphatemia, the other group did not have hyperphosphatemia. We found that those patients that had hyperphosphatemia had a much higher overall response rate of 35%, where the non-hyperphosphatemia patients only had a 5% response rate. And it was statistically significant with a p-value of 0.027. So to us, that was pretty encouraging, and then when we did further in-depth studies, we found that those patients with hyperphosphatemia, even if they were receiving the same doses of infigratinib, they seemed to have a higher serum level of the drug available, suggesting that hyperphosphatemia could serve as a surrogate biomarker, and we're hoping to validate that in a larger phase 2, phase 3 trial. So one of the studies that the company is opening is something called the PROOF302 study. My senior colleague, Dr. Sumanta Pal, is the PI for that study, and he wants to look to see in the advanced bladder cancer setting, the muscle invasive setting, and upper tract urothelial cancer, for those patients who have undergone surgery, if adding this particular medicine would help decrease the risk of recurrence of the cancer. And so far at the moment, there's nothing that's considered standard care that can decrease that risk. So this would be a very exciting study to see if in those patients with the FGFR3 mutation, if using this drug in the adjuvant setting would help improve that. So hopefully it will have some more exciting results to come from Dr. Pal and his team.